and welcome to the Pause It podcast. I am Dr. Sam, and with me is Dr. Robert. How are you, Dr. Robert?
Good, Sam. How are you doing today?
I'm doing really, really well. Today was my day off, so instead of working all day at the clinic, I just tried to cram everything that I have been neglecting to do
For a
outside of the
personal life,
clinic into one day.
I honestly I hate how you have to do that because I feel like you're so busy at work all the time, and all of a sudden you get home for a day, you're like, now I need to catch up on normal life, like laundry, dishes, cleaning, children. I don't have that problem, but some people
Yeah.
do.
No, I mean, it's crazy. Like, and then like, I never just let myself have a day because I feel like there's so much to do that I'm like, I have to do everything. And, my husband's always just like, pick like one task that you want to get done. I'm like, but I got to do it all.
And this is why we're a type A personality.
I know.
Must
He's
do
just
all the
like,
things.
he's like, that sounds like a great plan, but you have not enough time in the day to do it.
At least he's a voice of reason. That's why we love Paul as much as we do. So
He really
thank
is.
you,
He's
Paul.
literally like, pick one thing.
We all need a Paul in our lives. Can I borrow him for like a couple weeks? That'd be great.
Yeah.
So
He whip you into shape real quick.
sure,
You
no
guys probably
doubts.
have a little too much fun though.
Yeah.
Well,
Oh man.
one thing I was going to say is just getting onto what we're talking about today. Um, because we kind of talked a little bit about some of the springtime questions that we get and getting into, I know you live in perpetual springtime, like we talked about before, and I'm very jealous. But,
Yes.
but so this podcast probably is something that you deal with not so much because of the scope of practice that you are in, but maybe some of the repercussions. And we're talking about allergies. Um,
Okay.
yeah. So this is a big one because dogs are, I feel like, more and more affected by allergies. And it's like shocking how bad they can be and
Oh.
what a frustrating condition it is because there's no cure. That you're not going to fix allergies. You're going to learn to manage them, or you're going to just be fighting an uphill battle if you kind of just keep avoiding it your dog's entire life.
That's exactly the reason I went into ER medicine because it's something I can't fix, and I hate managing diseases, so I don't do internal medicine and I don't do allergies. But I respect all of my wonderful colleagues that do because it's tough, man. And owners, and good on you. Allergies are really tough, regardless of the cause. They're
Yeah.
very challenging.
Yeah. And so we're talking like actual chronic allergies. We're not talking allergic reactions that you probably deal with
Yes, that's my category. I can fix those.
all the time. You're like, that's a finite thing. I can fix that.
Yes.
But yeah, no allergies. And so what we're kind of gonna do is do like a part one and then maybe like a part two. So today we'll talk about probably the biggest, like the first category. And I think the important thing to understand is in dogs, there's really three different type of allergies that you get.
Yeah.
Environmental,
Mhm.
food,
Yep.
flea.
Oh yeah.
That's it.
Yeah. That's kind of the big three. They're
Yeah.
very prevalent,
Yeah.
but there's definitely a lot of them.
Yeah, and all of their issues will fall into one, two, or all three. And that's the other part of like I literally have a spiel when I'm like, okay, a 2-year-old's golden retriever comes in itching for the first time in the spring, and I'm just
Oh,
like, are they on flea prevention? Check the box, yes, no. And it's like, okay, let's get ready to have this conversation because it's always
but
an in-depth conversation.
oh, it's a long one, and it's a lengthy history. It's finding about all the foods that they're on, any treats that they get, what's their environment like outside. It's just what do they do at home that shows allergies, and it's a long conversation. It's definitely worth making a full appointment for.
Yeah, yeah. Well, there's no question. This is definitely not one of those. Oh, and by the way, he's been itchy as I'm walking out the door. Like that's not going to work.
No,
And I will say usually itchiness is probably what brings people to the vet. Like an itchy dog chewing on their feet, chewing at their, rear end, um shaking their head, scratching at their ears, rubbing their face. Not to say that like when they have an active infection or something like that, like yeah, that will bring them in. A big hot spot or something like that will definitely bring them in. But I would say it's like the itch first, and then I look at the skin and I'm like, well, they have a raging skin infection. So, and they're like, oh, they do? You know what I mean? Like sometimes people don't really know what they're looking at, but they notice that their dog is constantly chewing at themselves.
Yeah, I think that's the biggest thing. Like when you see your dog licking their paws a lot, they're shaking their head, they get frequent ear infections. Those are all signs of allergies. It doesn't always have
Hmm.
to be like red skin. A lot of times it goes with it, but like dry red skin, that's a big sign. Those are
Hmm.
all signs that your dog has allergies of some reason, and it's our job to figure that out.
Yeah. Well, and I guess my question is, do you get a bunch of dogs that come in raging ear infections, huge hot spots? I mean, you're seeing those, right?
Oh yeah, three. I think that's my text note at this point. There's a dog that comes with an ear infection at like 3 a.m. They're like, "Don't tell Parkins; he will not be happy," because it's my least favorite thing to see at 3 a.m. But I understand why though. It's not only is your dog having a hard time sleeping that night, but the owner then can't sleep that night because they hear their dog scratching and they're crying and it's uncomfortable. So it's a reason to go in. Maybe not always at 3 a.m., but it's
I
definitely
was
a
gonna
reason to
say
go
that's a 3 a.m. emergency. That's surprising to me.
all the time. Like honestly,
Really?
oh, I see it. Honestly, that's probably the one that annoys me the most. And I get it, but it's just like it happens all the time. Right in the middle of the night, they're like, I just couldn't sleep. My dog's miserable. And I guess I'd say cats get allergies too, but dogs are definitely more the predominant
Oh
one,
yeah.
I would say overall. But yeah,
Cats get
100%.
allergies, and that's a whole other. Cat allergies can be very tricky. I would say though, like so often cats, it's just because they don't have them on flea preventative, and they're like, but they're an indoor cat. I'm like, just put them on flea preventative. Your life will change, I promise. And like, it doesn't fix it every time. There's no question, but so often people do not recognize that indoor cats can get fleas, and
Yep.
I can't tell you the number of indoor cats that never step foot outside that I'm like, whoop, there's flea dirt, there's a
Yep.
flea, or there's tapeworms, or some very indisputable like your cat has fleas moment, or even just I'll say like, just humor me, try flea preventative and then tell me if
It's
they're still itchy. And, like,
because
the
it only
number of people that are
takes
like, "Yeah, they're not itchy anymore." I'm like,
that's because fleas
"Please."
only like it only takes like one flea to cause an allergy. Like one flea bite can make an allergy. So it's actually pretty impressive how sensitive some animals can be. So listen to your doctors when they say put on flea preventative because it'll save you so much headache.
Oh my gosh. And, like, with cats too, the thing is, like, you can have one cat that's not allergic to fleas and another cat that is, and is just tearing themselves to shreds, and it does not take long for them to do it. But the thing is that with cats, they groom, and so they will eat the fleas before you find them most of the time. And so, like, I don't have to see a flea to be like, "Well, that's probably what it is." You know what I mean? Like, you just get the history and, and I can pretty much tell you that that's what it is. Now, with cats, we do deal with other things, and we kind of need to like, kind of talk about allergies in general, including cats and dogs, right? Because it's the same,
Yeah.
truthfully, for both of them. I mean, they can all have flea allergy dermatitis, they can all have environmental allergies, and they can all have food. So I think probably it would be best to like focus on, okay, so we'll talk about environmental allergies in this half of the podcast, and then
Yeah.
part two, we'll get into the other two because they're not, I don't think, quite as long. And the fact of the matter is that they're not, flea allergies are very common, right? Very, very, very
Yeah.
common. But they're also very, very fixable. So that'll be a quick PSA at the end.
Yeah.
But environmental allergies are actually the most common,
Yep.
by and large, by far, most common. And I'm curious for you, I mean, they're all year round for you, right? Or do things
Yeah.
kick up at different times?
I would
Santa
say they
Ana
cook.
winds or whatever they are.
No, actually, I was gonna say word for word. Santa Ana winds are probably the one flare up we see, like when it starts kicking in.
Yeah.
Even my allergies, I don't get allergies much, but they'll kick in during like the springtime a little more, just because of that coming down from the north. So it's definitely a thing. But yeah, it's more seasonal. I guess it's so consistent though that I don't recognize like as much of a seasonality as probably you do.
Oh, no, no. But the thing that surprises me is that it's not just, oh, it's the spring and everything's blooming and I'm itchy. Yeah, that's happening and it's happening right now. I mean, I can't tell you the number of dogs because it's weird here in Indiana. Like, it was cold the other day. Like, literally, there was frost on my car, but then the flowers are still kind of blooming by the end of the day. You know what I mean? So it's like this very weird time that like still feels really cold. It doesn't really feel like spring has sprung, but if you look at all these itchy dogs coming in and cats sometimes, but like the itchy dog, like you're literally like, whoa. I mean, it is allergy season for sure.
Yeah, I
And
definitely feel that.
what was that?
it definitely flares up.
Oh
I
yeah,
feel bad for you
absolutely.
guys.
And then like I would say some years the summer is horrific. Oddly, last summer was pretty calm. I mean, yeah, we saw it and some of our worst cases were there, but like the summer didn't seem to be bad, but then the fall came and oh my goodness, did we have horrible fall allergies. Like worse than the summer. I
Oh,
do
really?
attribute a little bit of that though to the fact that people stop their flea preventative in the fall because they're like, it's cold. Cool. I don't have to be on flea preventative anymore. I'm like, not true.
They're inside, guys. They're inside. So,
Yeah. Well, and I think people like know already they've been kind of like taught and programmed. Like we start it in the spring and we go through the summer, but then we stop in the fall. And I don't think that those seasons really exist. Even in a place as seasonal as Indiana, it should be all year round because we see
yeah,
them all year round. And then there are some dogs that are going to flare in the winter, and that's just going to happen. I mean, there is absolutely different things that they can be, allergic to. And I think it's important to know that like some dogs are allergic to like living in a house. They're
yeah,
allergic to dust mites, storage
yeah.
mites.
It's
Guess
like
what?
they're
That's everywhere. I don't care how clean your house is.
yeah. I think that's the biggest thing is because they one of the ways to diagnose some of your allergies is to do like a skin test where they put
Mm-hmm.
little antigens essentially or little components of that allergy in your dog's skin and see if they flare up. And if they do, it means your dog is allergic to it. So it's like 100 tiny little injections, and there's
It's
things like
literally exactly
different
what they do to
trees.
people. I mean,
Yeah,
it's the exact same thing. We just have to shave a big thing of hair and
it,
basically give little pricks of all the little allergens and then see who
with blossoms.
what blossoms exactly. Now, I will say that that's a pretty specialized thing. I mean, like we don't have all those allergens. We're not a
Oh,
dermatology practice and you know, I think that the number of people that go to that length to actually diagnose
mhm.
precisely what they have, and there is also a blood test. I'm going to just say
Yeah,
there's like I mean, we use the Heska test not that often. I mean, we have access to it. We have an account with them, and there are times where it is worthwhile to do. The gold standard, though, no question, is the skin test. The
yeah.
absolutely. If you
It's
remember, at school they did both. Did you do
yeah,
derm at school?
yeah. They did. I remember doing both, and they compare the two. And I think maybe correct me if I'm wrong. I want to say they always thought the skin test was more accurate. The blood test was kind of like supporting evidence type thing.
I think
But
was also there was if I remember correctly too, and I could be wrong on this, but like I also think there was a certain time of year where the blood test was more accurate than
gotcha.
you know what I
That might
mean
be right.
than not. So but I think ultimately there's no question that the skin test is the gold standard. And even I had a patient, it's actually the first one in years that I can think of that went through and got the actual skin test. And they did the blood test first and they were kind of underwhelmed by it. And so they said, let's go ahead and do the skin test. So that was from the dermatologist themselves. So they did try it. I mean, they did it, but I
Yeah,
think that they didn't find what they thought that they were going to find. And so I think it's really important to know that like you don't always have to go to that length. And it's not a
yeah,
slam dunk even if you do the allergy test, like, yes, you'll know what they're allergic to, and you can then try to do immunotherapy. But just like in people, immunotherapy isn't a guarantee, and it can take up to a
yeah.
year to actually work.
Yeah, and dogs just have so many different allergies. And again, as Sam mentioned beforehand, they have allergies to food, which compound things, and fleas. So like you might be fixing some of their allergies, but not all of them. And it's just crazy how many different types of allergies they can have. There's different trees, different grasses. Like you said, the
Hmm.
mites. It's literally everything. So
Yeah.
I only the times I recommend it for certain patients is when they're either really young because I'm like this will probably be better for your dog because you're gonna have allergy lifelong.
Right.
And like if you have a 12-year-old lab, like all right, no offense, you're towards the end, hopefully, it's keep them as comfortable as possible with medications. And there's some very good medications to keep them very comfortable.
Hmm. Hmm.
Um, but like they're lifelong, it's like, oh, they might benefit from it. So I think it just depends on the patient or if they're really severe,
Yeah.
then they probably
And
need the most.
I think for me, like I can say that like kind of when I walk into a room, right, where I'm like, okay, this is the very first time that this dog is presented super,
Mm,
super itchy, with a really bad skin infection, with a hot spot, with a flare up of an ear infection, with the foot thing, where any one of those things, all of those things, whatever it is. But let's say that's the first time, right? I'll
yeah,
usually come in there and I'll usually say, okay, look, I can clear this infection. That's fine. I can give them antibiotics. In some cases, steroids are indicated. Got to get that inflammation down, get that itch under control.
Yep.
And if it's a one-off and it goes away, cool, great. But I'm going to tell you right now, there's a very big possibility that your lab, golden retriever, bulldog, doodle,
Pitbull.
oh, pit bull. I mean, like there are certain breeds that they walk in, they look like this, and I'm like, we're gonna get to know each other well. And so
We're
I'll
good.
usually say, like, I'm just putting it out there that if this recurs, or if we do this, if we do some steroids, we get that itch under control, we get the skin infection under control, and everything looks great, but then they start itching again, don't wait for it to look like this again. Call me and let's now discuss what are some of those things that we can do to kind of, to keep things at bay. But I will try to put the bug in people's ear that, like, this is the beginning of the conversation. This is not
Mhm.
the end of the conversation. And I always tell people, like, I wish that I had some magic cure for allergies, but I don't. And I have had multiple dogs with allergies, and they have all manifested themselves in different ways. So I can't tell you now what your dog's going to look like. I can't. Because I
Yeah.
can tell you Phoebe had chronic ear infections, Regis had chronic skin infections, Gus chews his feet.
So you just picked all the breeds that like to have allergies.
I do. I do. But like, and the thing, like you mentioned, there are some really, really, really awesome things out there that, we've been lucky enough. We never worked in a time where Apoquel didn't exist.
Oh,
You
thank
know,
God.
I mean, I know. And so this is a really great medication, and it brings comfort, eh, unbelievable comfort to patients, and is a long-term solution. They can be on it for a long time.
Yep.
Cytopoint came out, which is an injection that you can give, and we can explain more about it. I mean, certainly, what all these things are, which is awesome. Even atopica, I mean, like that is such an important medication. I use that all the time, which is cyclosporin, which is, I mean, like these drugs, like they're really incredible because at one point there really was just, here's a steroid and here's antibiotics. And
Here's Benadryl.
but Benadryl doesn't work. I'm sorry. It
It
just
does.
doesn't.
No, it
I
does.
wish that it did, but it doesn't. And I warn people all the time. Like usually what I say is, okay, have you ever tried antihistamines on your dog? And then usually they're like, no. I'm like, okay. So don't bother with Benadryl because it's not going to work. But if any of them are going to work, Zyrtec is your best
Yeah.
bet, right? Because that's your best bet. So if you're going to do it, try Zyrtec. Make sure you're using a high enough dose, because that's the other thing. People are like, I gave him half a Zyrtec. I'm like, that's not going to work. Like dogs process antihistamines faster than we do. They need a higher dose than we do. So in order
Mhm.
for it to work at all, you got to have them on a proper dose. But then I'm like, okay, cool. If your dog responds and stops itching on Zyrtec, you just won the lottery. That's great. I'm so happy. There's nothing safer. There's nothing cheaper. Try it. Try it for 5 days. But if and when it doesn't work, call me and I'll give you a cytopine injection.
So I think Cyberpoint's my favorite, honestly. It's so much more of a set it and forget it, but it's just taxing because they don't have to come in. And I guess, how do you guys do appointments for Cyberpoint injections? Like, can you guys do like a tech appointment? Is it?
Yeah. So first let's explain what cytopoint is. So cytopoint
Yeah.
is, yeah,
Sorry.
I mean, it's a really, really cool, it's basically like a biologic for dogs, right? So it is absolutely only for dogs. You can't use it for cats. It is particular to dogs. You can't give it to people. I don't know why you would want to, but you can't. Um, and what it does is it blocks the itch.
Yep.
Basically, that's it. It's not immunosuppressant. It can literally be given with like anything. There's really no contraindications. You look it up. It's a really, really safe medication. I'm sure there have been adverse effects in the world with cytopoint. I know that
Yeah.
there have been. I know that there's reports of it, but like so rare. It's very, 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 very safe. Um, and I have used it on Gus before, when he was itchy. It works, I would say 90% of the dogs that we use it on, it really
Yeah.
works well. There are certain manifestations of allergies that it does not work for.
Yeah.
Those really inflammatory guys, the ones that are chewing their feet, the ones that have like that you constantly think they have anal gland issues, I'm plus minus on whether or not cytopoint's going to work. I can almost tell now which cases it's not going to work for. And I also know when like Apoquel is not going to work too. Like it's weird, but you start to get to know
I see a
who's
pattern.
likely to respond. Now, I still have an order of how I do it because the thing is, all of these things are kind of expensive, right? I mean, like,
Yeah.
that's the bottom line. That's why I always say, like, hey, if Zyrtec works, try it. Nothing cheaper, nothing safer. Like, totally go for it. But the fact of the matter is the reason these drugs are expensive is because they work
Yeah.
like awesomely well.
And yeah, you mentioned the age earlier, like a golden retriever comes in at the age of 2 and starts like itching their paws. Honestly, if I were most owners, get insurance for your pet from like day one.
Mm-hmm.
Keep it for the first 2 years. Find out what type of dog or cat you have. If you have
Mm-hmm.
a dog that likes to eat everything,
Mm-hmm.
keep it. If you have a dog that's
Mm-hmm.
like, no, I'm a good dog, I don't eat stuff, great. If you have a dog that shows up and starts having allergies, for God's sakes, you'll be happy you have insurance
Insurance.
because
Yeah. Yeah.
paying for those set point injections and those appointments, it's not a pre-existing condition anymore. And that's the biggest thing insurance companies are going to get you for those
Mm-hmm.
pre-existing conditions. So if you have it from day one, you're okay. You can always get rid of it, but just have it from day one. It's so much easier to avoid those pre-existing conditions. I promise you.
Yeah.
So yeah, just my
Yeah.
public service announcement.
No, it's
Uh,
but it's true. And actually that's like really kind of perfect, right? Like 2 years, you're gonna know so much. And there are, and it's not to say dogs will sometimes present earlier than
yeah,
2. It's like 1 to 5 is like the most common time for allergies. Now, I have had a few cases where dogs that really didn't have allergies their whole life, somewhere around 7, 8, 9 starts to come
yeah,
a little bit. Those aren't usually the most severe cases, though,
yeah.
generally, unless they've moved from one climate to another. Because I've
Mhm.
had that where they lived in one sort of place and then they moved here and now their skin just like blew up. You know what I
Yeah.
mean?
No,
But
I think it's really good advice because yeah, most of the time it's when they're younger, but yeah, there are definitely flare ups, or they
yeah,
definitely get them older too.
yeah. But I think you're right. Like the Cytopoint thing is good because it's lasts for 4 to 8 weeks. But I have had
Yeah,
plenty of dogs that you give them one per season and they're fine.
yeah. I've
You
heard the
know,
same thing from owners. So like, yeah, I got it once this year. My dog's been great.
it's
So I'm
been
like,
great, exactly. And it doesn't last that long, but just gets them through their bad part. Now, I
mm,
have also though had patients that need it every month. Like
yeah,
clockwork, they start to itch, they need it every month, no questions.
mm,
Um and then, for those guys that it really just doesn't work for, that's usually where I'll go and say, okay, let's maybe try something like Apoquel, which is a little bit different. It definitely works like on, in the immune system and it blocks the itch and the inflammation. And I think
yeah,
that's the other thing that is kind of missing with the Cytopoint, which is fine for most dogs, right? But like
yeah,
for the ones that are a little bit more affected, and you can use them together. It's not like first choice the best thing you should do, but like sometimes you don't have an option and you have to,
yeah,
you know? And so sometimes you can mix them together.
mm,
And then there is the cyclosporin, which is a definitely an immune suppressant, but at the dose you're using it for derm stuff, you can use it long term. And
yeah,
for some of those like bulldogs that get those huge interdigital cysts, like they have those big, huge feet, man, that's like the only thing that works for them.
yeah. It's the combination of the three is super helpful. Using like kind of what your dog, you just gotta see which one your dog responds to. And again,
Yeah.
if you have a good vet, he uses them on a regular basis, like Sam. They'll have maybe a better idea than I would. I use set a point only just on an ER basis because I'm like,
Yeah.
I'm never gonna see you again. You're here at 3 a.m. Good luck. Go see your regular vet and have a good conversation. But after
Do
that,
you warn
it's
them that it takes 3 days to get to its highest level?
I will now.
You
That's
know
why
what
I
I
don't
like
use
to
it
do?
on.
You know what I really like to do a lot of times is give them a pred pulse, 4 days pred,
Oh, nice.
and
Okay.
or you could do 4 days of Apoquel because Apoquel works in 4 hours. So you
Oh,
can
okay.
give them 4 days, depending on what they have going on. Like if you have a dog that has something that they can't have steroids, but there's nothing but wrong with just giving them 4 days, good steroid, get all that inflammation down, and that cytopoint will take over and your aces.
I didn't know Apical worked that quickly.
It
That's so
does
nice to
four
know.
hours.
Yep, see, this is why we do this podcast, not only for your learning, but for mine as well. This is why I don't do skin.
Well,
So,
it's I mean, the things that you deal, this is literally what I deal with. I mean, like 15 times a day.
oh,
Like
I literally
I
walk
I
into
do
owners'
this
rooms.
all day long. Huh?
I even walk into owners' rooms sometime when I hear they're there for like a skin issue, and I'm like, I'm gonna be very honest with you. I'm the worst person you're ever gonna want to see for skin stuff. Like I see this very rarely, and it's not my cup of tea. I'll save you $180 and say, go see your regular vet in the morning. You'll be much better off. But
But
honestly, it's
that's
always my
very
best friend.
kind that you do that. I mean, like, cause that,
Yeah.
not everybody would do that.
Oh, just because I don't feel right about it. Just like one day I'm gonna take a course from Dr. Sam about how to be a dermatologist again because it's gonna be some time. But until that day hits me, I'm gonna stick with ER for as long as I can.
Well,
So
the one other thing that I would say too is that it is also important that people understand that Apoquel, Cytopoint, Atopica, Pred, any of these things, if they have an active infection, it's not going to work. You have to get rid of infection. Infection is in and of itself itchy, and if you don't get rid of that, you're not going to fix the problem.
yeah, I think that's the big thing that I'll see every once in a while when there's actual active skin infections. Clearing that up first is the most important thing. And then just maintenance stuff that you can do on a regular basis that are not medical. This is like the only thing I remember from dermatology way back when. But like oatmeal shampoo baths that helps take away the itch a lot of times, or wiping off your pet's paws as they walk in the house with like chlorhexidine wipes. A lot of times that will help diminish the reactiveness
And the
to
thing
those
is
allergens.
now, so now they have, so a lot of the ones that we use in school, like the
Mhm.
chlorhexidine ones, they
Yeah.
have a different concentration now that is
Oh,
antifungal and antimicrobial. So it'll take care of
see.
bacteria and yeast. But they also have developed a ceramide that will like basically
Oh,
heal the skin so that like protective layer, the like, you know, that biolipid layer of the skin
yeah.
will become fortified. So that is actually really great. I find so for my active like itchy guys, I'm not a
Mhm.
huge fan of the oatmeal shampoo because I feel
Huh.
like it's too drying. So there are
Okay, I've heard that.
shampoos. Yeah, there are shampoos though that are just the ceramide. So you
Mhm.
can use that. But the honestly, the medicated shampoo, like I just use that as maintenance for those guys because it won't dry out their skin. They do so great.
Yeah.
And I was gonna say that I think any adjuncts you can do to be proactive and then prevent infection or just recognizing it. Like in the spring, you know your dog gets itchy. The second you see them itch, go get the Cytopoint injection and start the shampoos. Clean their ears regularly. You know what I
Yeah.
mean? Like there's great ear flushes. And I mean, there's one that does yeast. There's one that does bacteria. There's one that breaks up biofilms. There's one that is micellar and doesn't do any of those things, but just gets all, you know what I mean? Like there's all these
Yeah.
amazing things and they all do different things. So if you have a vet that's like comfortable with all the different options that are out there,
Mhm.
then you really can prevent. I mean, and I have seen people who just like didn't know what they were supposed to be doing, just take a 20-minute, conversation we had in a room, really take ownership of it and have a dog that went from literally a mangy looking, red, angry, sad, itchy, poor little guy
Wow.
to beautiful hair coat, got through, a little itchy, but we got around it. Like two different dogs, but like, I mean, same dog, but like, you get what I'm saying? Like just that education and learning how to take care of it makes a world of difference, but you have to be committed. You cannot ignore it because it will just get worse.
Yeah. I think I've seen some pretty remarkable changes from dogs that had it from the beginning, and then they kind of like you said, it's kind of like two different dogs. It's so cool. Like it's something that you can really make a significant difference in your pet's life. You may not be able to fix it, but you
Hmm.
can manage it very well if you pay attention to what's bothering your dog and get on it early. The sooner you get on that stuff, the better. Like I see, unfortunately, owners that have waited all week because the dog's been shaking their head for a couple of days, and then they come at 3 a.m. because like, oh, I can't sleep now. It's like, well, it's been going on for a couple of days now. Like, and it's tough because people can't get to see their vets right now. That's the biggest challenge. So I don't blame them. Like urgent cares and ERs are busier than ever just because it's so busy at your general
Hmm.
practice.
Hmm.
I mean, how long are you guys still booked out quite a bit?
So for like routine stuff, we
Mhm.
are,
Okay.
but for like we always leave a certain amount of time open for
Okay.
like urgent visits and things like that because um we have to be there for them. You know what I mean? Like we have to
That's
leave
really
time
nice.
open. And so and honestly, like we even leave time open for new patients because we know that there's some people who, I mean, I think people don't realize how much they need a vet till they need them. And so if you can be that kind of like safe place for them and you could find a way to do it in your schedule. So I mean I think some of our days are like pretty hard because of it. You know what I mean? I
Yeah.
definitely think that it can be rough sometimes, to try to be all the things to all the people, but some really rewarding days and some people really, really like appreciate that.
Yeah.
And then also too, we do try to make it really so like for Cytopoint you were asking before, like people can just call and be like, "Hey, my dog's really itchy. And as long as we've seen them in the last year, we have like a relationship with them or whatever. Yeah, they can do a walk-in back appointment, like a tech appointment, where they just go. So they borrow them, they take they give them an injection and they go. Now, the one thing I will say is my techs are so well trained, and all of our assistants, they look at their skin. If they see anything that looks like a skin infection, they'll come grab a doctor and be like, "Hey, so and so is here for a Cytopoint injection, but we think that they have an ear infection, or we think they have a skin infection. Can you look at it?" We'll just take 5 seconds to go take a look at it. And I will go, "Yep, you're right. They do. Let's go ahead and fill an antibiotic. Can you talk to them about the shampoo? Can you talk to them about that?" Like, my techs have heard this conversation enough times. They know all the ins and outs, the ups and downs. So they can go and kind of relay my spiel a little bit and say, "Hey, yeah, this is definitely," usually the ones coming in though asking for a Cytopoint injection, this isn't their first rodeo. They've had the
Yeah.
conversation with me. They're just being reminded, if they have an active skin infection, we want them to be successful. So
Oh yeah.
we're gonna give them, an antibiotic, and then I'm gonna say, "Okay, follow up with me in 2 weeks. Go ahead and make an appointment so that I can see that everything got better." And then, okay,
Yeah.
great. And then that way it was, instead of me being in a room having all that time, okay, now it's a much shorter, like, time to just say, "Hey, here it is. My tech can, start writing the note for me, and I can go in and finish it up." Like, it just, we can make it so that we can see 5 of those, as
Oh yeah.
opposed to, just 2 in that time. You know what I mean? So there's
Yeah.
things like that. But the initial time that we meet somebody about allergies, that is not a short one. That is a long
No,
one.
that's a long conversation. That even makes my ER appointments longer than usual because I'm
Yeah.
like, this is a long one. So
Yeah. Well, because you really have to go through the entire thing. And
yeah.
so I think probably that's where we'll leave environmental allergies from now. So
That's
part one is
one.
done. And then part two, stay tuned, and we'll kind of get back into the whole allergy thing. So I hope that was helpful. Hope we'll probably touch a little bit back and forth on both, but um, that's environmental allergies. If you have any questions, you can always email us at podcast@mybalto.com. And yeah, do you have anything else to add about environmental allergies?
Uh, Good luck. Sorry. Just kidding. You're gonna do great. Uh, I'll see you guys all next week.
Well, this has been the Pause It Podcast, part one of allergies, and we'll get into part two next time. Thanks for listening.
Thanks, guys.